lymphedema is a dreaded complication of breast cancer treatment, and it can be associated with increasing local regional therapies like axillar lymph node dissection, lymph node radiation, as well as some forms of systemic therapy. And while we've been seeing declining rates of lymphedema over the years, due to the fact that we do less lymph node dissections, for example, it's still a major problem. And studies show anywhere from 10% to 30% of women after breast cancer are at risk of developing lymphedema. Traditionally, we've done basically symptomatic assessment and measurement. We usually ask women if their arms are heavy. We may do a tape measurement, and then we send them to therapy once they've developed lymphedema. But just like other chronic diseases, we've started saying, what if we try to detect this process early and intervene early so that we can reduce the risk of long-term issues? And so really the data has moved towards prospective surveillance. So making sure that women who are at risk of developing lymphedema are followed for breast cancer-related lymphedema and that they can be intervened early. There's also recent data from the PREVENT trial, which actually compared prospective surveillance with tape measurement to prospective surveillance with bioimpedance spectroscopy. And in both of those arms, women who were found to have early lymphedema were given compression garments. And what the study showed was actually that the bioimpedance arm, which was able to detect the lymphedema earlier, most likely, had lower rates of chronic lymphedema because the thinking is that they were able to catch them earlier, they were able to intervene earlier, and so therefore they had lower rates of chronic lymphedema.